Hey guys, Dr. Green here with another video. Today's video we're going to be talking about infections and more importantly infections during penile implant placement. We're going to go over things that you can do as a patient to help give you the best chance of success. And when you're talking to surgeons, what you should be discussing to give you the highest confidence that you're going to get the best success after surgery. All right guys, so to start it off, first of all, infections are one of the most devastating complications you can have during penile implant surgery. And infection rates range from anywhere from less than 1% to up to 2%, depending on patient's health, diabetes, and other risk factors. However, there are certain things you can do to give you the best chance of success after surgery. Now, if you do get an infection, and that's a pretty bad thing. You have to get another surgery, you have to remove that device, clean it out, put in a new device. So there's a lot going into it if you do get an infection. So what you want to do and what we want to do as surgeons is give you the best chance of success to prevent infection and give you the lowest possible risk of infection. So in this video, we're going to talk a little bit about that. We're going to go through things you can do pre-op. We're going to talk about things that you can do even before pre-op. You're going to talk about things that your surgeon can do intraoperatively, and then things you can do after surgery as well. So let's get into it. All right, so number one, you're thinking, hey, maybe I need to get a penile implant. Maybe that's where my journey's headed, and I want to set myself up for success. Now, the first thing you should do before you even have talked to a physician, before you've talked to a surgeon, before you've got a surgery date is get your general health under control. And that means if you have diabetes, getting your A1C down to an acceptable level, which would be in the normal range. That means you have sustained low blood sugars, not just, oh, I check my blood sugar every once in a while, and sometimes it's normal, sometimes it's not. No, you need sustained low blood sugars. The other thing is quit smoking. If you are smoking, if you're using tobacco products, all of that stuff impedes your healing, because what tobacco products do is they decrease blood flow to areas because they cause constriction of those vessels that bring blood out, especially to the penis. And that can also contribute to erectile dysfunction, but they decrease blood flow, which decreases healing. You need blood flow to heal. Same thing with diabetes. Those little blood vessels get damaged, which causes erectile dysfunction because you don't have good blood flow down to the penis. So in turn, because you don't have good blood flow to the penis, you're also not going to get good healing after surgery. Increases your risk of infection from less than 1% to up to 2%. So that's about a 1% increase in infection. And that's a big deal when you're talking about infections for implanted devices. So number one thing you can do before you've even gotten a surgery date, get your general health under control, get your diabetes under control if you have diabetes, and stop smoking if you're smoking, or even chewing tobacco, all of that stuff, stop it. All right, so you've decided you want the implant, you've got a surgery date scheduled, your diabetes is under control, you've stopped smoking, all of that's done. What's number two? Number two is starting about 3 days before your surgery. I tell anyone between 1 to 3 days before surgery, I'm going to want you to start washing with a antiseptic or an antimicrobial soap. And that's things like Hibiclens that you can buy at any local grocery store or any local pharmacy, but it's a pre-surgery antimicrobial soap. It has chlorhexidine in it, and that's something that just sterilizes the skin. That gets all that bacteria off of your skin. And I tell people to shower twice a day, 1 to 3 days before surgery. That just helps to get rid of all the bacteria on the skin. You're never going to get rid of all the bacteria on your skin, but it can help to cut down those colony counts and cut down those levels to where when we do surgery, hopefully it decreases your risk of infection. And that's something you can easily do at home. Just shower twice a day for 3 days beforehand using that special soap, paying special attention to the genital area that we're going to be working in. Just really scrub well down there. You don't need to do anything else. Just scrub down there real well with that soap and water and then dry off. And do that for 1 to 3 days before the surgery, twice a day. And that's hopefully going to cut down those bacterial counts enough to where it's going to decrease your chance of infection. So now it's the day before surgery. You're excited. You're going to get your surgery done tomorrow. Hopefully this is going to set you up for success in the long run. And you're thinking, oh, maybe I should shave down below because they're going to be working down below. Don't want a lot of hair there. Want to look presentable. However, do not do that. Do not shave the day before your surgery. Now, if you shave months before, that's fine, but I wouldn't shave in the week leading up to your surgery. And that's because you can get little tiny skin nicks, and those little skin nicks can get infected or get colonized with bacteria, and that increases your chance of infection. There's actually been studies shown, not with penile implants, but with other surgeries, that people shaving at home before surgery increases the risk of infection. So do not shave down there. We will shave after you're completely asleep. We'll clean it all up. We'll get rid of any hair. And that's been shown to decrease the risk of infection in the past. The other thing is make sure there's no sites of infection anywhere else on the body. Make sure you don't have any boils or skin lesions or infections going on anywhere around the scrotum or the penis. Even if you have things on your feet, let me know before surgery because I want to know those kinds of things. Remember, I'm just trying to do the best that I can to set you up for success. So any types of infections throughout the body, let me know. I want to know about it. It doesn't always have to cancel your surgery, but it is something that we should know about so that we can treat it to give you the best chance of success. The other thing is you don't want to have any urinary tract infection before surgery. So sometimes we'll treat you before the surgery to just make sure the urine's clean, or we'll check your urine beforehand just to make sure everything's clean. But if you have any burning when you're peeing, anything like that, please let us know. All right, so you've done everything you can do pre-op to set yourself up for success. You're going to the hospital today. What can be done once you reach the hospital, once you reach the doors to ensure the best chance of success? And it starts with preoperative antibiotics. Everybody is going to get antibiotics preoperatively, whether that be some pills that they take before the surgery, and sometimes I'll send out pills before the surgery depending on some factors. But most of the time, people will just get antibiotics once they get to the hospital. And those are IV antibiotics. So those are going straight into the veins, not oral antibiotics. They work much quicker. And usually we'll use a mixture of 2 to 3 different antibiotics and possibly even an antifungal medication as well. And for this, we follow the regulations from the American Urological Association. But we want to make sure that those antibiotics are in before we make the incision on the skin. So those antibiotics need to be in before we make incision. And that's because we want those antibiotics to be in and working before we even start the surgery. So I'm very judicious in making sure that you may be asleep already, but in making sure that you get your antibiotics before we actually start the procedure. In addition, sometimes we'll send some antibiotics after the surgery as well, some pills. Studies don't really show much improvement in that. However, it does make us feel better sometimes to send antibiotics, and it makes us feel like we're doing the most that we can for the patient. However, it's kind of hit or miss if that actually makes a difference or not. I tend to do it just because it makes me feel better, and hopefully it makes the patient feel a little bit better. But again, a little hit. Now I want to talk a little bit about what happens during the surgery. And when you're talking about the surgery with a surgeon, make sure you kind of ask them what their thoughts are on this and what techniques they use, or what device you're going to get for surgery. Because there's 2 devices. There's the Boston Scientific devices, or there's 2 companies that make devices, the Boston Scientific devices and then the Coloplast devices. Both of these have different properties with antibiotics and infection prevention that we're going to discuss. But anytime you get penile implant surgery, the implant is going to come into contact with some bacteria somewhere along the line. Somewhere during the surgery, it's going to come into contact with some bacteria. And there's really nothing you can do to completely prevent that. Now, we do all the sterile technique, we do no touch, all that kind of thing. But there's always going to be some contact with bacteria. And what our job is to reduce that and make sure that the bacteria that it does come into contact with doesn't lead to an infection. Okay, so the first thing is, like I said, there's 2 different device manufacturers for penile implants. There's others that are coming up, but we'll talk about the 2 main ones, Coloplast and Boston Scientific, and they each have different ways to prevent infections on their implants. Boston Scientific has an actual coating called an inhibizone coating present on their devices. And this makes the implant look a little yellow because it has that antibiotic coating on it. And that antibiotic has two different, or that coating has two different antibiotics impregnated into it, both rifampin and minocycline, which help to prevent infection, because if bacteria attaches to the implant, hopefully it will get killed by those antibiotics. Now, Coloplast has a different way of dealing with this, and that's through a coating that's called a hydrophilic coating. Hydrophilic means loves water. So what it does is anything that implant is soaked in before the surgery or during the surgery is going to get soaked up into that coating. So if you put antibiotics on it, it's going to get soaked up into that coating. If we use something called Irrigation, which is a chlorhexidine wash or an antibacterial or antiseptic wash instead of antibiotics, then that will get soaked up into that coating. The other thing that the hydrophilic coating helps with is it helps prevent the bacteria from sticking to the device. If the bacteria can't stick to the device, then they can't really colonize on that device to cause infection, hopefully. Now, bacteria can get around this, but those are two ways that these two companies have come up with to combat infection. And I wouldn't choose one device over the other because of this technology. They've both shown to have similar success with preventing infection, so they both work very well, but they're both just different methods of combating the same problem. During surgery, there's several other things that we can do to help decrease the chance of infection or hopefully give you the best success after surgery. And one of those things is something called the no-touch technique. And the no-touch technique was developed in 2011, so it has been in use for a while. It's actually been shown to decrease infection rates from anywhere. It used to be about 2%, and now after the no-touch technique, in people using the no-touch technique, it's decreased to about 0.5% or less than 1% in healthy males. So it has made a significant difference in the rates of infection. And what the no-touch technique is it's a way to prevent the implant from touching the skin. The skin is where most of the bacteria are. So the least contact that we can have with the skin, the better. Because if we're not transferring this bacteria over from the skin to the implant, hopefully we won't get enough bacteria on that implant to cause an infection. And what the no-touch technique does is it's a very clever way of using drapes and using antibacterial cling film, kind of like that cling plastic wrap that you get at home that you use to cover dishes and things, but it's a cling wrap that you put over the genitals during the surgery, and we actually make our incision through that cling wrap so that we never touch the skin whatsoever. That enables us to minimize contact of the skin with the implant and hopefully decrease the chance of infection, because those bacterial counts are going to be as low as possible whenever we do put that device in. So that's one way, is the no-touch technique, and that's a way that I 100% believe is an amazing innovation in penile implant surgery, and it's something that every surgeon should do, and that when you're looking for a surgeon, make sure that they at least do some kind of minimal touch technique to where you don't touch the skin as much. All right, so another thing during the surgery that you should talk to your surgeon about is irrigation during surgery. And by irrigation, I mean washing out of the tissue with either an antibiotic fluid or an antiseptic fluid. And things have kind of shifted to where we always used to use antibiotic fluid. We would mix a bunch of antibiotics in saline or salt water and use that to kind of wash out the tissue during our surgery. However, now things have started to shift away from that and actually more to something called Irricept, which is a antiseptic solution. It has chlorhexidine, which kills bacteria, in water. And what I use that for is to just completely irrigate out all the tissue, including the tissue inside of the penis, after we've made all of our incisions. And that mechanical aspect of really flushing out the tissue and really flushing out the incision is going to wash away bacteria, and then any bacteria that are left behind will hopefully be killed by the antiseptic solution. But I think most of it is that mechanical aspect of actually washing out and flushing out the tissue. We also kind of coat the devices in this solution as well, to hopefully prevent bacteria from sticking to the devices. So that's something that you should be cognizant of when you're picking a surgeon, is make sure that they are irrigating things very well and irrigating the tissue out really well, washing everything out, because that is going to lead to a better result and decreased chance of infection. And then one more thing for after the surgery is just make sure that all of your bedding's clean, your towels are cleaned, your shower's been cleaned, all of that kind of stuff, just to prevent bacterial overgrowth and bacteria from coming in contact with the incision. Now, this stuff is kind of just makes me feel better kind of thing. It's not really rooted in data or anything like that, but it does make me feel better if everything's clean. We do use a skin glue over the incision at the time of surgery after we finish to hopefully seal off that incision from any bacteria coming on contact with it. But however, it does make me feel better if you just do everything you can to prevent infection, meaning clean your sheets, clean your pillows, clean your towels, all that kind of stuff. Just makes us feel better to give you the best chance of success. And lastly, kind of the most important thing for you as a patient, just make sure that you're going to somebody experienced and somebody well versed in these techniques, and somebody that does a lot of penile implants, and somebody that hopefully is well trained in doing penile implants. And that's just because if you go to somebody who does a lot of penile implants, who's well trained in penile implants, they're hopefully going to be doing a lot of these techniques to give you the best chance of success. In addition, hopefully, because they do a lot of penile implants, their surgery times are going to be shorter. So your time under anesthesia is going to be shorter. But that also means that the time it takes to put that implant into the penis is going to be shorter, which hopefully will decrease the contact time of the skin with the implant and hopefully decrease bacterial counts on the implant just because of a shorter time spent outside of the body. So the other thing is just make sure you go to somebody who you get along with, because God forbid there is some kind of infection or complication after the surgery. You want somebody that you feel comfortable talking to and somebody who's going to take care of you. So make sure you go to somebody who's you feel comfortable with and somebody who you can talk with. And that wraps up our video on how to prevent penile implant infections, or how to give you the best chance of success for penile implant surgery. If you have any questions or anything, just drop them down in the comments below. Hopefully I'll be able to get to them. And then if you want to see me or you want to talk to me, you can call our office, make an appointment, whatever works for you. But I hope to hear from you guys soon. See ya.